Hello, everyone. Welcome. I'll let you go ahead and get comfortable. If you'd like to go ahead and turn on your webcam and give us a wave, it can help have people to actually present to. Love to see your smiling faces. You can also find the chat icon and open up the chat window. We'll be using the chat feature if you'd like to send in questions during this evening's Q&A. You can go ahead and just say hello there, maybe tell us where you're joining from. All right. So this evening's topic is vision therapy and strabismus surgery. And we have patient here with us, Melissa Daniels, who's going to tell you a little bit about her journey from childhood, and then her experience with vision therapy, and then strabismus surgery, and now vision therapy again. So she's totally willing to take questions throughout the presentation. If you'd like to use the chat window, you can post those publicly, or you can send them privately to me. Melissa herself isn't going to be monitoring the chat necessarily. It's just I will pause and interrupt her. And just a reminder, she's not going to be giving any medical advice, that she is a patient. She's sharing her experience and her journey. The views, thoughts, and opinions expressed in this presentation belong solely to Melissa. They do not necessarily reflect the views of Vivid Vision or any of the iHeart VT partner organizations. And without further delay, I'm going to go ahead and let Melissa introduce herself and share with us her story.
Hi. I am excited to be here. Thank you so much for having me. It's really exciting and a little bit nerve-wracking to be here. I am going to pull up my presentation. All right. So I wanted to share tonight about my journey kind of from the very beginning. So I'm going to kind of go through this whole process. I'm going to talk about my childhood and then some stuff about my school, talking about how I got to where I am today, how I found vision therapy, what made me decide to have surgery, and then what I'm doing now that my surgery is kind of over. So please ask questions. I want to talk about what you guys want to hear. I could literally talk for hours about vision therapy and strabismus because I'm kind of obsessed. So please put your questions in there and feel free to interrupt anytime that you want to hear something new. I will start here. So I was born with strabismus. I was born with esotropia, which means my eyes were turned in. You can see in this lovely picture over here with the drool. That is the only picture I have that shows my eyes, face on. So sorry for the grossness, but I had 55 diopters of esotropia. So my eyes were turned in super far. And my parents noticed, they had friends that noticed and kind of pointed it out to them. And they found an ophthalmologist and took me in, and they definitely figured out that I had strabismus. And so they had me patching and used glasses with prism, hoping that I wouldn't need surgery. But within a month or two, it was pretty obvious that I was going to need surgery. So I had my first surgery when I was 6 months old. That's here. I love this picture because this was the day before my surgery. And it just makes me happy to know that my mom took me in to get professional pictures taken the day before surgery. Like some people might wait till the eyes were straight, but no, she made sure it happened before then. So I kind of love that. I ended up needing another surgery a couple months later. So this is right before my second surgery. And after this point, the doctor basically said, you have to get more serious about wearing those glasses or her eyes are going to keep going out. And so they were pretty straight, as you can see in the picture. They look pretty good. But when I took my glasses off, it would go out, and not near as bad though, but it went from esotropia to exotropia. So from the time that I had my surgeries when I was a baby, my eyes started going out. And it was never too bad. It was like, you know, maybe 15 degrees or so. So that was the first couple surgeries. And then when I was 3, they finally were able to do more in-depth vision exam, and they were able to test like my acuity and found out that I did have some amblyopia. So I had, in my left eye, it was 20/50, and in my right eye, it was 2100. And so I started doing more aggressive patching. I don't know, I was patching the whole time, but started patching more maybe, I have no idea. And then they also tested me for stereo vision to see if I had 3D vision and my eyes could work together, and I didn't. So I've gone through all of my medical records just like looking for some hope. Like maybe I had it at some point, but I never did. Never had any stereo vision, never had any depth 3D. That was all never part of the process. So after, I believe it was a few years, the patching worked and I didn't have the amblyopia anymore. It was, my vision was 20/20 in my left eye and like 20/25 in my right, and it stayed there for the rest of my life. I eventually had another surgery when I was 7 years old, and I don't know, it went well. I don't know, I don't remember it. Just remember being scared, but it all worked out. I continued to wear glasses with prism. Again, the surgery corrected my eyes and they were perfectly straight for about a year. But as I went to those like later checkups, it started drifting out again. But I wore the glasses with prism all the time. And then I went to this appointment in 4th grade, and I remember it so well because the ophthalmologist said, "You're better. Your eyes are better. You don't need to wear glasses anymore." Because my vision was fine. It was 20/20 and 20/25. So I didn't need the glasses, but they had prism, and I don't understand why I was made to feel like I was better. My mom says she got the same impression that like, yeah, you were done. It was 4th grade and I was completely done. And so this is about the time where I stopped wearing glasses and I was supposedly done and my eyes were better. I wish, right? Wouldn't that have been nice? But they weren't better. So I just love these pictures so much. They're just so horrible, but I had to share. So this is me in 7th grade over on the left. And you can see that I definitely have an eye turn there. That was the first time I was ever teased, if you can believe it. My eye was intermittent. So a lot of times it was straight, but a lot of times it was out. I had no idea. I literally thought that my eyes were completely better. I did not know I had an eye turn at all. And I remember being in English and this boy was sitting across from me and we were doing some partner work and he said, "Your eye is weird." And I was like, "No, it's not." And he's like, yeah, why isn't your eye looking at me?" I was like, "It is looking at you." And he's like, "No, I think something's wrong with your eye." And I was like thinking, I'm like, well, I used to have strabismus. And like, I really was like, so like I did not know like what he meant. And he's like, "Okay." And I didn't react at all. I'm sure the way that kids normally react when they get teased. I mean, because he was kind of like, wasn't being super nice about it, but I just didn't react because I was like so confused. Like, no, strabismus is a secret. No one knows about that. That's like my secret from my past that no one has ever heard of. And I went home and I said, "Mom, are my eyes weird?" And she's like, "No, they look normal." And I was like, "Oh, okay." And that was it. That's the only time in my life I ever remember someone actually telling me verbally, "There's something wrong with your eyes." I always knew that they didn't work together. I knew that like the functional part, like I knew that my right eye wasn't as good and I knew that they weren't working well, but I didn't realize that there was like a physical turn all the time. I don't know. I don't know how I didn't know because I look at these pictures and I should have known. Like I know I did get my prom pictures back and my eye was turned and I was like, what in the world is going on? So there were pictures that I'd get and there was a turn. But anyways, so I was kind of oblivious. Again, in these high school years, I never really struggled with school at all. The only things I remember struggling with, I took piano lessons and I couldn't read the music and play the song at the same time. It was really hard for me. So I just would memorize the music. And I had other friends in piano. Like, I'm kind of skilled. That's why I can memorize music. But really, it was because my eyes weren't working that I had to memorize. That was my only option. So anyways, that was a struggle that I had. And then once I started taking AP classes in high school, things got kind of scary. The math classes were fine, science classes were fine, but when it started being like, I remember European history just about killed me, these long reading assignments, and I just couldn't keep up. I couldn't read I could read, but I couldn't comprehend, and I'd read and reread, and I just wasn't making sense. And I just thought that was normal. But I was just, my eye was kind of bugging me, and I just felt like my eyes were really tired, and I didn't know what was going on. So my parents actually found a place to take me, and we had moved to California, and we went to this vision place, and I don't have any records. Like, I wish I could find out where I went, but we don't know where it was. But I went and had my regular eye exam, and then they put on these glasses that tracked, I read this passage, and it tracked my eyes as I was reading. And then it, you know, I had to answer all these questions after, and it tested my reading level, and I was reading at like a 6th grade reading level, but I was in, I think, 11th grade at the time. And I was like, that's weird. I read it higher than a 6th grade reading level. Like, I didn't really believe it. And my eyes were all over the place. Like, you could kind of see where my eyes had been reading, and they were really bad. And started talking to us about how we needed to come back in because I needed to learn how to read, and that my eyes weren't working. And I remember being like, I'm not dumb. Like, I feel like he was saying that I wasn't smart. Like, it was like special ed or something. And I was like, this is dumb. And I went home, and we got in the car with my mom, and I started laughing. I'm like, can you believe he thinks I'm dumb? Like, I was so full of myself, I guess. I'm like, I'm a straight A student. I'm not dumb. And so we laughed, and we never went back. But I am 99% sure that it was a vision therapy office. Like, I know it had to have been. So it's kind of ironic, kind of funny, but I really believe I was not supposed to do it at that time. That was just not the plan. So anyways, I just forged ahead. I stopped taking AP history and English classes and focused on math and science, and that kind of became my thing. I did fine. So I ended up going to BYU when I went to college, and things got hard again, and I decided to go to another optometrist, and I was like, something's wrong with my eyes. They're just not, like, I feel like my right eye is like not doing very good. And he tested my vision, and it was 20/20 in this eye and 20/25 in that eye. And he's like, you're good. I said, no, I'm not. My eyes are not working. And he just said, you're fine, you're good. And so I was like, okay, whatever. And I just went on with my life, got married to this handsome guy, and we had 4 kids, and life got really busy. And I didn't have time to worry about my vision because I had a bunch of kids. But every time I would have a baby, I swear my eye would get worse and worse and worse. And finally, after I'd had my last child, my eyes started really bugging me. I felt like my eye was actually dying. That's how I would describe it. I'm like, it's dying. Like, what if something happens to my left eye and then my right eye is dead? And I didn't know how to explain it. I didn't know how to articulate what was happening, but I just knew something was happening. And again, I didn't know that my eye turned out still. Like, I mean, I would see it occasionally in pictures, and I'd be like, oh yeah, sometimes my eye goes out, but I had no idea that it went out that far that you can see in that picture. No idea. I was more concerned about the functional stuff. So like, I would play tennis. I was taking tennis lessons, and they'd say, keep your eye on the ball. And I'd be like, I can't keep my eye. Like, who keeps their eye on the ball? It's moving too fast. Like, that's not possible to keep your eye on the ball. And I would, you know, miss it. And anyways, that was a struggle. Driving at night became kind of treacherous. I took a babysitter home one time, and there was oncoming lights, and I got lost a little bit between, I couldn't see the lines anymore, and I swerved off the road because I thought the car was like coming at me, and it wasn't. And it was just super scary. And I realized like something's wrong. Like, I can't drive at night anymore, and I don't know why. And so I finally went to this optometrist, and I was like, look, I don't want you to tell me that there's nothing wrong with my eyes, because something's wrong. Because I'd been to several optometrists, and they'd all told me my eyes were fine. And I was like, my eyes, there's a problem, and I don't know what it is. And he's like, well, you have strabismus. You probably need surgery to straighten your eyes and make them work better. And I was like, oh, okay, now we're like getting somewhere. And I said, I don't really want to have surgery. Is there another option? And he said, well, you can try patching if you want and see if that fixes the problem. So this was just a normal optometrist. So that's what I did. I went home, I got some patches off of Etsy, like this one. Isn't it nice? And I started patching for 4 to 5 hours every single day. And it was the worst. I was running into walls. I was like cutting my hand. I couldn't see, like there was just nothing. But my eye, for the first like 8 weeks though, like I saw a little bit of improvement, but not much. There was no difference. Definitely my eyes were not coming together. They weren't working together. My eyes, I wasn't feeling more safe driving or anything like that. And I don't know, I probably won't share the whole story, but if you want to read more, you can go to my website and I share the whole thing. But I had a really cool experience where I felt inspired to read scriptures every single day with my patch on. And I did that for like 3 or 4 months. And it took me about an hour every day that I was reading. And at the end of that, not at the end, but somewhere in the middle, all of a sudden I was able to control my right eye. And it was so cool. So I'll show you that picture. So this was like the first time I realized that I could either look with my left eye and then my right eye would go off, or I could look with my right eye and my left eye would go off. And so that was the first time in my life I've ever been able to switch from eye to eye. It's always just been my left eye. And so I was like, okay, I'm almost there. Like I have control of my right eye, I have control of my left eye, and now I'm just going to put them straight and I'm going to be done. So I kind of thought I was almost to the end at that point. And I just need to patch a little bit longer. And so I was sick of patching, and I thought, I'm just going to get a contact lens that I can put over my left eye that will block out my vision, and it'll be like patching, but I won't have to wear a patch and ruin my hair or my makeup or whatever frivolous thing I was worried about, because I hated patching. And I called around to all these different optometrists and said, hey, can you make me a contact that'll block out the vision in my eye? And they're like, why do you need that? And I'm like, well, and I start telling my story, and they're like, no. But finally somebody said, hey, you should call the Idaho Vision Development Center. They help people like you. And I was like, okay, you know, at this point I was like open to whatever. And I called, and they're like, yeah, come on in and come for a free consultation. And I just went in, and I definitely was like, oh, sure, let me guess, you're going to tell me my vision's fine. Like, I wasn't expecting anything. And for the first time in my life, I was just blown away when I went to this appointment, because instead of everyone telling me like, oh, your eyes are fine, you're totally fine, like there's nothing wrong with you, he's like, oh yeah, you have some problems. And he started doing these tests. He did this one test, the picture over here, it's called the Worth 4-dot test. And I think that's how you say it. I don't know. That's how it looks. And I don't know how to explain it here, but you wear these red and green glasses, and one eye is seeing 3 maybe like green dots, and one eye is seeing 2 red dots. And so they say, okay, how many dots do you see? And if you have both eyes working together, you'll see 4. And if you only use one or the other, you'll see 3 or 2. And if you're using both at the same time, but they're not like merging images, you'll see 5. And so I was seeing 3, and I was like, there's 3. And then I'm like, oh wait, no, there's 2. Wait, there's 3. And then I realized my eyes were switching back and forth. And I was like, how are you doing that? How are you making my eyes switch? And I was so excited. And I was just like getting kind of nerding out on all this. I'm like, what are you doing? Like, what is this? And he's like, well, these are red and green glasses. And he was trying to explain it to me. I'd never seen red and green glasses or heard of anything with that before. And anyways, the more I talked to him, the more I realized like, this is amazing. And then we did my whole like functional testing or whatever. It was like 3 hours of testing. And I was like, this is it. This is what I've been looking for. I just need to do vision therapy. And it's because my eyes aren't working together. That's all my problems, is that my eyes are not looking at the same place. They're not seeing the same thing, and they're not working together. So I don't have depth perception. Like I didn't even know I didn't have depth perception. Like I knew I couldn't see like 3D movies. But then I'm like, I think I can. I don't know. I was like, I didn't really know. So I found out that I had no depth perception, but that maybe I could get it. And he did say from the very beginning, he said, now your eye turn is pretty severe. So you might need to have surgery as part of this. That might be part of the process, because not vision therapy can't always fix strabismus alone. I was like, okay. And then he told me how much it was going to cost. And I was blown away for the second time, because it was so expensive and no insurance coverage. And it was really disappointing for me, for sure, because I just thought, this is impossible. I don't just have thousands of dollars to spend on myself, especially as like a mom. I'm like, I've got 4 kids. Like, I can't, we don't have just thousands of dollars laying around. And so I luckily have the most patient optometrist ever, Dr. Nielsen. He has been so patient with me. I'm kind of a little bit ornery sometimes, and he's always so nice to me, thank goodness. But while I kind of figured out how I was going to pay for it and saved up money and that sort of thing, he gave me things to do at home. So for the first about 5 months, I just stayed at home, and every 4 to 6 weeks, I would go in for like a progress type visit. It wasn't actual therapy in the office. And the plan was that I was going to build up this foundation. I was going to build up some foundational skills. And then when I started coming full time, I'd kind of already be like ready to take off. So I worked on integrating primitive reflexes, which I still don't totally get. I'm going to just be honest. Like, I didn't really have any, I'm like, I don't have problems. I'm fine. Like, I watched my kid who did vision therapy. I'm like, he's got problems, you know, love him, but he needed the primitive reflex training. Like, I understood, I could see it visually, but for me, I'm like, I'm fine, but I still did it. I did all the exercises he told me to, and it was fine. I worked on ice stretches, just like tracking my finger, that sort of thing. And then I had this fancy red lens patch that like took patching to the next level. And then looking at like these stripes going across the TV. So I did that every day for several months. And finally, Dr. Dan said, all right, you can't keep doing this. You're not going to make any progress. You either have to like come or not come, but you can't keep doing this in between. So I decided to come. So I started going to vision therapy every other week and started seeing some really great progress. So over on the right, I have this awesome virtual reality headset. I started doing Optics Trainer, which is like a vision therapy program to help with whatever, those types of problems. And it's virtual reality. So that started helping. Over here on the left, you can see me with this thing. It's called a vectogram. It's called the GEM. So those of you in vision therapy are probably very familiar with the GEM. But when I first started, I would look at the GEM, and the idea is you're wearing these glasses. And again, when I can see one thing, when I can see the other thing, there's two rings. But if you use both eyes together, you can see this illusion that the ring is floating either in front or behind. So when I first saw this, I would look at it and it was flat, completely flat. I saw absolutely no depth. There was no illusion of floating. There was nothing. And we would use all these, if you look on the left, I've got like all these special things in top. Those white things are called plus lenses. And then I had prism glasses on to help. Still, I couldn't see anything for weeks. I think it took 20 weeks. Was it 20? No, that was something else. Maybe it was like 10 weeks before I first saw the ring kind of just floating ever so slightly forward. And I was so excited. So over this time, like the next 8 months or whatever, I went from seeing nothing to being able to kind of see it float in and out if I, engaged with my finger. But by the, within a few months, you can see in this middle picture, I was able to do it without any special help. Well, it's pretty exciting. So I was making quite a bit of progress. Had this amazing experience. It was the first time I ever saw a STEREOPSIS. Oh dear, I don't want to get emotional, but I will because it was so amazing. I was just in my living room and I looked out the window and I saw this flock of birds. And, if you look at this picture, that's how the sky always looks to me. It's just like there's like a blue sky and there's like black things on it, right? And they're all just kind of flat. And I never thought they were flat. They just looked like birds. But when I saw them, I felt my eyes kind of burning. I knew that both eyes were working because I'd experienced it enough times with like my exercises that I kind of knew what that felt like for both eyes to be working. And all of a sudden, like the birds were like 3D. I could see them moving like in and out, and it was just amazing. It was like they were dancing, and I could see the space between the birds, and it just took my breath away. Still, like anytime I see with STEREOPSIS in real life, I like have this physical response where like my heart, I can just like starts beating and tears, like it's like amazing. And it's so interesting, people who've gone through it before, I don't know if others have the same experience, but I didn't want to tell anyone because I was so blown away by how amazing it was. And I just was like, everyone sees this all the time. Like, I'm not living in the same world as everybody else. And it felt kind of lonely, I guess is a good way to explain it. Like, I'm not seeing, and it's so different. I'm not seeing it the same as everybody else. And it's so incredibly different from what they're seeing. Like, I just felt like I wasn't having the same experience. So anyways, obviously I'm a talker as I'm talking 100 miles an hour. So it didn't take me long. I shared it. But for a few days I was like, didn't tell anyone, not even my husband. And then finally I was like, by the way, I saw with 3D one time, and it was awesome. So that was super cool. But again, I wasn't making all the progress that I wanted to. I think this, actually, I have these backwards. So the one on the right is the one that was earlier. That was when I was going every other week, and I was realizing like, okay, I want this to go faster. So I started going every week, and you can see over here, I don't know if you guys can see the mouse or not. Okay, the picture's on the right. The third picture over, my eye is still out a little bit, right? So as I was like focusing it near, I was starting to be able to straighten my eyes. But when I was looking in the distance, I still couldn't. But as I started going in more frequently and was like really getting dedicated, I was able to like perfectly straighten my eyes. And that's like the second picture over that says January 2020. I was able to like really lock my eyes in and see with STEREOPSIS almost on command. Only not at a distance at all, but like up close I was. And there's a lot of exercises that I was able to start doing better. Yes. So anyways, all this progress was happening and it was amazing. I was getting the STEREOPSIS, but the problem was that like, this is what my eyes still looked, it was still the same. Like when we would do a progress visit and measure it, it was still 35 degrees out. It was 35 degrees out when I started, and it was still at 35 degrees out. Yes, I could straighten them, but I could only hold it straight for like a few seconds before it just burned and I had to relax. I couldn't do it. I couldn't keep them straight and relax at the same time. And I had this like big idea that, you know, my optometrist said, I think it's time to consider surgery. And I'd already known like surgery was already in the back of my head. I kind of had always felt like surgery was going to be part of my journey, I guess. I didn't want to. I was like, no, I can do this. I'm going to be one of those people that like doesn't need surgery for strabismus. I'm going to be like Sue Berry, right? Everyone wants to be Sue Berry because she's the best. And so it was disappointing, but I thought, okay, if I can see with STEREOPSIS when I straighten my eyes for those few seconds that I can keep them straight, then imagine if surgery straightens my eyes and then I can see with STEREOPSIS all the time. And I was like, okay, this is going to be fantastic. I'm going to have straight eyes, then I'm going to be able to see all the time, see whatever, you know, and it won't be such a struggle. It'll just be natural. And so I decided to have surgery. So I traveled to Salt Lake City, Utah, and had strabismus surgery with Dr. Peterson, who's amazing. He actually works at the same office that I had all my childhood surgeries at, which is kind of funny. So the surgery went really well. You know, at the end of the surgery, he said, oops, okay. He said, your eyes look really good. This picture on the right, I'll scroll over here so you can see a close up. So, oh my goodness. Okay, there we go. So the top picture, I'm sorry, it's so gross. So look away, close your eyes. You can block my video if you can't handle this, but the top picture is like hours after the surgery, even maybe like 30 minutes after my surgery. And my eyes look pretty straight. And so when he finished, he said, your eyes look fantastic. I don't think we're going to have to do anything with adjustable sutures. But within about 12 hours, my eyes looked like they do on the bottom. And my right eye turned way in. And I don't know, I think my brain was just rejecting that straight position. And it was used to saying, okay, if my eye is out, I make things look right by making it straight and by turning it in. And so my eyes were straight and things weren't looking right. So my eye turned in. Unfortunately, that wasn't the direction we were going for. And my right eye actually hurt a lot more because it was like fighting against all those stitches and stuff more. The left eye was where it was supposed to be. So anyways, it was pretty awful, honestly, that first week. Double vision like crazy. It wasn't just usually when I'd have double vision before surgery, which I did totally have, you know, here and there with vision therapy, but like the background would all be the same, but then I'd see like two of the item I was looking at. So it was like double central vision, but my peripheral was all meshed together. But after surgery, the peripheral was also mixed or double. So I was like seeing two whole rooms and they were at an angle. So it wasn't like flat rooms, they were angled in. It was really confusing. I like had just a constant headache, dizziness, nausea. I just felt like I was going to throw up all the time. If you've ever done vision therapy, it felt like I was wearing yoked prisms all the time. And I thought, oh, well, that's okay because I get used to the yoked prisms. So I'll get used to this. And Anyways, it was the worst. I was a disaster. If you follow me on Instagram, you probably saw some of that, of my like, this is the end of the world. I've made a huge mistake. What have I done? I've ruined my vision. Why did I do this? I wasted all my work in vision therapy. I had come so far, and then I did this, and it was, anyways, I was, yeah, a little depressed. It was bad. But luckily my surgeon used adjustable sutures. So on the inside of my right eye, when he did the stitches, he left the stitches in a way that he could adjust them later on. So I went back in a week later. Brace yourself. I have a picture, guys, and it's super gross. Just be ready. He went in and adjusted the stitches, and it was the worst thing ever. I promise, it was the worst. Some people are like, it's like going to the dentist. And I'm like, it's like going to the dentist, but a billion times worse. Just, you can see the instruments coming in and out. I kept like almost passing out. Anyways, doesn't matter, because even though it was the worst, it was awesome because it made my eyes straight, which was a good thing. You can see over here, this picture on the right is before, like after surgery, but before the sutures. And then the one on the left is after he adjusted the sutures. So they got much more straight. So after that, I guess we can look at this. Well, it doesn't matter. Doesn't matter what we look at. So after that point, my eyes got a lot more straight, and I got the double vision went back to how it was before surgery. So like the central was double, and only in the distance, not up close. I wasn't having that up close. The peripheral, it all meshed together. No more nausea, no more dizziness. All that part went away. So that was a huge relief. I started going back to vision therapy like right away. I was so anxious about it. And I was like, I have to go. I have to get in. I have to make sure my eyes stay straight. I have to figure out how to see with both eyes. I was like, I'm a little intense. And Dr. Dan here in the picture, he was my therapist for those first few appointments when I couldn't do any of my vision therapy activities. I couldn't track a pencil. I couldn't see any like 3D whatsoever. I was like falling apart, feeling like life was ending. And I was really struggling. And one of my biggest things that I struggled with was knowing that if my surgeon had undercorrected instead of, because he overcorrected slightly, so my eyes aren't perfectly straight there. It's turned in a little bit. So now instead of having exotropia, I have esotropia. And my brain is so good at moving my eye straight, you know, like it's called converging. I'm really good at converging my eye, like going like that. And I'm really bad at this direction. And so now I can't move my eyes straight very easily at all. I have to completely learn that skill. And so I've, of course, like cursed my surgeon, like, how come you didn't leave it undercorrected? And I had this great epiphany that has helped me so much with that. And that is that I already know how to move my eye this way, and I need to learn how to move it the other direction so that my vision can be balanced. Because if I can only go one direction, then I'm kind of off balance. But if I can go both ways, I can find that center more. So I don't know if that's true or not. I'm totally not a doctor, but it makes me feel better to know that it's okay. I'm just going to get really good at diverging now. So it does feel a little bit like I'm starting over, but things are coming so much faster. Where the first time when I did the gem, it took me 10 weeks to be able to see anything. This time it took me like a week and a half, 2 weeks, and I'm starting to see it now. Still not it's not like perfect. Same with like virtual reality. I got a new virtual reality headset, the Oculus Quest. It's the best ever. Just a quick plug here. I wish I was a rep so I could get paid. I'm not. If you're doing vision therapy, don't even consider the Oculus Go. You have to get the Quest. It's not even a comparison. Don't even consider it the other way. Anyways, it's so amazing. I started doing Vivid Vision, which is also amazing. So good. And again, I'm picking up those skills so much faster. Like I think today I did it and I was at the same range as I was like maybe 6 months ago. So it's all coming back super, super fast. I'm not there at all yet, but I'm getting closer. I finally get to wear binasal occlusion glasses. They're so fantastic. I actually think they're the worst, but they supposedly help. So I don't know, I wear them. I don't know what they do. I still don't get it. I ask a lot of questions and then I forget. And then just a lot of work on peripheral because my eyes are more pointed in. I kind of am like losing some of my peripheral. And so I'm like learning to watch for that, and that's really helping. So I'm 8 weeks out from surgery now. I had surgery 8 weeks ago yesterday, and right now I feel super hopeful. So some people might look at, where is it? They might look at this and say, okay, this was not good, right? You should have not done surgery. Your eyes were doing so good before, and now they're doing terrible. But I don't believe that at all. I totally think that surgery was supposed to be part of this. And I feel very confident that I'm going to get all the way there. And I'm not there yet. I don't have STEREOPSIS. I'm not able to use both of my eyes, but I can in some situations. And actually, in the last couple weeks, I have been feeling, since I started getting the new virtual reality stuff going, I have had a few things where I almost feel like I'm having STEREOPSIS. Like I'm not seeing it, but I can feel it. Like I'll feel things like all of a sudden feel really close to me, like they're popping out at me. And I'm like, oh, I know what that is. That's like the beginnings of STEREOPSIS. Like I felt this before. And I was in a movie theater, and all of a sudden the hallway felt huge, and then it felt kind of small and huge. And I was like, things are changing, and I don't know exactly what's going on, but I know this is what it feels like when my brain's trying to use both of my eyes together. So super excited about this. I think I'm coming back as long as I have a good result. I guess if everything goes to pot, I won't be back, but I don't think that's happening. To share that I have reached the end and I have STEREOPSIS. So I don't know when that'll be. I'm really hoping by the end of the school year. That's my goal, is to be done with vision therapy by the end of the school year. But I just put this on here. If you want to follow me from now until then, I put all this on Instagram. It's really fun to connect with people. I feel like some of my biggest success has been from tips and tricks I get from people on Instagram, whether like therapists or optometrists, or just like actually connecting with other people with strabismus is super helpful emotionally. So anyways, that is my story. That is all. I don't know if there's any questions or anything about anything that I talked about, but I'm definitely open to answering anything. I talked a lot, so I don't know if there could possibly be anything that I didn't cover, but let me know.
All right. Well, I don't have any questions here waiting in the chat, but if anybody would like to throw a question up in the chat for Melissa, or if you want to unmute and ask Melissa a question, feel free to do so.
That sounds fun.
Is there anything?
Hello.
Oh, there we go.
Oh, Melissa. Hi. Okay, thank you for having us this session with us, Ned. I enjoyed it. And by the way, what I wanted to ask is just that I caught up with this session in the middle. So I couldn't understand as to prior, were you having amblyopia or your case was a different one?
What's your question?
Okay. Oh, someone else. So you're asking if I have amblyopia?
Yes, you suffered from amblyopia.
I do not. I mean, my right eye doesn't see as well as my left eye, but when I take the test and I read the letters off the chart, I can get all of the letters with both eyes. But there's a huge difference. My right eye isn't as strong. It's still like a little bit more blurry, but somehow I can still read it. I don't get it. But so no, I don't have like severe amblyopia or anything.
Okay, because I'm trying to understand this. I've also went through surgery.
Okay.
Actually, I had esotropia due to amblyopia, as they say.
Okay.
And then now my case was that my eye really turned so badly. The deviation was so bad, but I didn't suffer from double vision, cases of double vision. I think my mind had learned to suppress the diverted eye. So,
Okay.
but my struggle the most was mostly the cosmetic part, because the stronger eye, which is my right eye, could really do the whole lot of job, a whole lot of work without the assistance of the bad eye, I would say. So when I visited the optometrist earlier when I was just 15 years. They did try to diagnose what could be done with my eyes and what was the case, because I think my parents had seen that I'm suffering with using this only eye. So if this eye of mine is exposed to light, when the stronger eye is exposed to light, when I see now, when I'm in the darkness, it just shuts. So it makes it blur also in a manner. So they could see that I'm suffering here and then. They took me there, and those specialists did try to see if the muscles with the eye are still flexible, but they said eventually there's nothing can be done with that weak eye. The only thing that is left for me is only the cosmetic part, which is to just align the eye. That's it. As for to improve the vision, absolutely nothing can be done. Well, those apparently with my parents, we didn't continue with that because they felt like there's a risk, of which there was no risk. There were just superstitions with them. So I took it upon myself that when I'm old and when I can afford, I will just do it on my own, because it really affected, all the self-esteem and everything.
Yes.
And then that I eventually had an opportunity just last year, December 2019, December. Met up with this ophthalmologist, and then he went through with the surgery, of which for the first time, my eyes look aligned.
Awesome.
I won't say the vision was improved. It was never improved. I still can't use my left eye. I still can't see out of 3D. So I was just trying to find out, besides me being content with my eyes seeing straight, they do really see straight. I don't know. I never even asked my doctor as to how many diopters now is the difference between my eyes, but he was quite happier with the results. He said there's nothing further to do with my eyes. So with your cases, I'm hearing that your weaker eye, in fact, both eyes of you did at some point see out of 3D and so on. So with your advice you can give me regarding vision therapy, I would like to find
Totally. So I think it's super important. I think that that's the hardest thing for people with strabismus, is that usually you go to an ophthalmologist, and I don't really know of any ophthalmologists that actually recommend vision therapy. And so you don't ever hear about it. But I would highly recommend for anybody that's watching, because some people are just interested in cosmetically aligning their eyes, which is great. Like if that's what you're going for, then that's fine. But I think there's a lot of people that would want to have that experience STEREOPSIS. And so you go to the website covd.org. There's a place on that website where you can find a clinic. I think this is right, Kellen, correct me if I'm wrong, but you go in there and you can type in, either there's some that's for the United States, and then it's also like all over the world. You can find optometrists that practice vision therapy near you. And I would just say, even if you choose not to do it, just go in and have a consult and just see what they think they could do. Because for some people, it's different for every single case of strabismus. No two people are the same. So I can't give medical advice because I'm not a doctor, but I can tell you to go see an optometrist that practices vision therapy. They're called developmental optometrists. So I don't know, hopefully that helps. It looks like we've got another question in the chat box. Is that right, Kellen?
Yeah, we do have a couple of questions here, actually. So one question really quick, Melissa, people did want to see your Instagram and your website information again.
Hey, okay.
Maybe we could just leave that up for a minute or two.
Absolutely.
All right. And then another question we have for you is, are you still seeing double? If so, is it intermittent or constant?
I am, and it's definitely intermittent, not constant at all. And I can't quite I think I'm just going between suppressing and using both eyes. I think if both eyes are turned on, I'm seeing double, but I'm suppressing my right eye. I've kind of gone back to that. And I know a lot of people worry about surgery causing double vision. I 100% do not think that's what caused double vision, because I was completely suppressing there. A few days after surgery, I was completely suppressing, and I could already start to feel it going away. And so I think that if you don't want both eyes to work, your brain will easily just shut off the one if it's not been a problem before. So the reason I'm having double vision is because I keep exercising both eyes and I'm trying to make them both work. So I'm going to have double vision. That's just part of it for now. I mean, it's going to go away, hopefully. Fingers crossed.
Okay, and Gabriella asked, how long ago was your surgery? Was it painful? How did you handle recovery with kids and other responsibilities?
So I had my surgery 8 weeks ago, and you know, some people it's like no big deal, but it was hard for me. It was super painful, and I just kept ice on my face and slept and listened to podcasts and books for like 2 days straight, maybe 3, before I wanted to take the ice off. And then so it was a few days that was pretty bad, but I was on painkillers like ibuprofen around the clock for like a week. And then I got my sutures adjusted, and then it was started all over again. And so luckily my husband was able to take off work, and he took care of the kids for those first few days. And I literally just laid in bed. But other people are like back to driving within a few days. I did not feel comfortable driving for like 2 weeks. So yeah, it was hard. I don't know. You do it though, you're a mom, right? You just make it work. But yeah, it was hard. It hurt. I don't know. It was worth it. But it sucked during. I did not like it at all. I was whining a lot.
Mia from Finland made a comment that double vision can be a good thing too. It can be improved a lot, like mine, into stereopsis. So obviously a viewer who has a similar story and experience there.
Right. The double vision is the first sign. It means that both eyes are working, and you can't expect both eyes to just automatically know how to work together. So there's got to be those two different views so that your brain knows how to put them together. That's one thing that I'm working really hard on right now, is when I do have the double vision, not just blinking it away, because a lot of times I'll just hurry and like move my eyes and then it goes away. But I'm trying to just allow it there so that my brain can see like, oh, those are the same thing, and then maybe want to put them together, you know, give it a chance.
And I did post in the chat the COVD website, the OEP website as well. Both of those are good international websites to check for vision therapy providers near you. There are also specific websites to the UK, and that's babo, babo.co.uk. Or if you happen to be in Australia, New Zealand, they have an organization called ACBO, and that's www.acbo.au.org. So there are, thankfully, VT providers all over the world, and hopefully, if there are people here hoping to find some help, you can connect with a provider in your location. Do we have any other questions from anybody? You have a lot of thank yous for sharing your story.
Can I ask you a quick question?
Yes, please.
Okay, so I have a 5-year-old, just real quick. He had 2 eye surgeries. First, he had it for esotropia. Second, he had it to correct the exotropia. It was an overcorrection of the first one. He's supposed to have a 3rd eye surgery now, because his eye still deviates, kind of like Melissa's to the, well, deviates out and up too. We went and saw a vision therapist here locally, and they did a test real quick on him, and they do recommend vision therapy. We went back to his ophthalmologist, and he said that vision therapy would only work during the period that we would do the vision therapy. And I guess it will stop working once we stop doing the therapy. Kind of just like we do occupational therapy and physical therapy. So it has to be a continuous thing. And the fact that insurance doesn't cover and it's out of pocket is just, as a parent, it sounds not feasible to me, especially when we get this feedback from not only one ophthalmologist, but we've seen actually few of them for a second and third opinion, because obviously I don't want to go and do a third surgery, but in the same time, we don't have thousands of dollars to do vision therapy. So I would like to hear from you maybe of examples of vision therapy sticking and correcting the eyes. Thank you.
Okay. So I can't talk about myself because I'm not there yet, but I know that actually I have a really good friend who's my neighbor, and I found out that she was born with strabismus. She had 3 surgeries as a kid, but she did vision therapy. So she's my same age. She's probably like 30, 32 or something. And hers has stuck. She hasn't had any problems with an eye deviating at all in her adult life. She has STEREOPSIS and is able to use both eyes completely. And she did the vision therapy when she was a child. And so I think it's more common that if you're a child when you do the vision therapy that it sticks. And again, I'm not a doctor, so this is just my opinion. I know that adults that I know that have done vision therapy do have to continue to do vision therapy after they're done. So what I mean is, when you do vision therapy, you go in every week for an appointment, but then they give you a lot of exercises to do at home every night. So every day I spend about an hour doing homework for vision therapy. And so what I know is going to happen for me and for probably any adult who does this is that after you finish your official vision therapy and your in-office visits, you won't necessarily need to keep doing an hour of homework every day, but I don't know how much, I don't know, an hour a week, maybe, I don't know, a little bit of time every day. Strabismus isn't something that just easily goes away. So I think if they're doing that when they're a child, it's a lot more likely to stick without having to continuously do vision therapy throughout life. And the longer you wait, probably the more it's going to take to maintain that. So strabismus isn't something that's just like quick fix. I'm trying to think if that answered your question. Kellen, do you have anything to add to that as a professional?
Yeah, I think another place that you might want to look into, and maybe you're already a part of the Vision Therapy Parents Unite page on Facebook. That's a great, very active community full of patients and parents, as well as optometrists and vision therapists, where you could post your question, and people are very willing to share their experiences there. I did post on the Vivid Vision website, we have a gallery of patient success stories. Those are vision therapy success stories, not necessarily just related to Vivid Vision. Those are patients of many different diagnoses, different ages, patients who are post-surgical and who have then done vision therapy after surgery. So hopefully those are some resources for you.
I wanted to add too that it's very hard to find any ophthalmologist who supports vision therapy in any way. I am very lucky that the one I happen to go to kind of does. He does. He supports it. He's just like, it's going to be a lot of work and it, hopefully works, but I don't know. But most ophthalmologists are going to tell you that vision therapy is like witch doctory and it's never going to work. And it's like, you shouldn't try it. And I'm here to say it's not true because I had 0 stereo vision when I was a kid even. It's not like I'm relearning something I already knew. And I was able to get that. And yeah, I didn't get all the way yet. I needed surgery, but I know I will. And so it's definitely possible. If you're still talking about your child, I'm 34 and it's working for me. So it's definitely going to work for a kid. And yeah, I think it is easier for kids than adults, but yeah, it's still possible.
Yep. Did anybody have any other questions they'd like to pose or comments? We're pretty much come to the end of our time here. So anything else you wanted to share or add, Melissa?
No, I think we're good. Thank you guys for being here. And hopefully that helps someone.
Yeah.
I don't know who, but.
Well, we're looking to welcome Melissa back, like she mentioned, in a few months and get a check-in and see how she's doing and see how her therapy has progressed. So we hope you'll stay tuned and look for that update.
Oh, I see one question. Do you see that one? About vivid vision?
Oh, I didn't.
It says, did you use vivid vision before or after beginning to see stereopsis? So I've only been using vivid vision for like a week. So my optometrist isn't a provider for vivid vision. So I actually have this awesome Dr. O'Mara out in Maryland. I live in Idaho, that is kind of consulting long distance. So I was actually using Optics Trainer, which is also a really fantastic program. It's kind of similar, but vivid vision is just like kind of on steroids. So I was able to see stereopsis before vivid vision too, but I can see how vivid vision would make it happen faster. It's pretty cool. Okay. And any other ones? I think we answered everything.
Yeah, I think we got everything. All right. Well, thank you all for joining us. Thank you, Melissa, for sharing your story and being active. It's a really great thing to see you sharing your journey and helping get the word out there.
Well, thank you for having me.
All right. Have a good day, everyone. Good night. We'll see you again soon. Bye-bye.